Hi, Melinda. I'm Grace.
Hi, Grace. Nice to meet you.
I'm going to be interviewing you today.
Thank you.
Are you comfortable? Would you like a glass of water before we start?
I'm fine, thank you.
Oh, okay, great. So I'm going to start with a super basic question. Just why don't you tell me a little bit about yourself and about your past work experience?
Well, I am a Bostonian, born and raised. I've been in healthcare for about 10 years. I started off taking a certificate program as a medical administrative assistant and followed up with a small community center. Then I was hired at Mass General as an operations associate, which is like an entry level secretary's position. I moved on from there a couple of years later to bed management. And a couple of years after that, I became a supervisor team lead in bed management for a number of years. I'm currently the staff assistant to the central resourcing team at Mass General Hospital, which is consistent of rapid responding nurses, patient care associates or nurses aides, and the clinical nursing supervisors for the hospital. I support them in their daily scheduling and their time plan, and I do the payroll and any other obstacles that might come along our way.
Oh, great. Describe to me a time when you worked well on a team. It sounds like you've worked on a number of different teams. So tell me a little bit about a time that you felt that you worked well.
Oh, absolutely. Well, at the hospital, we kind of have disaster drills just in case something happens in the community that everyone and every employee is ready to be deployed in any instance. So it was a team of 100 volunteers. We were broken down into smaller teams, about 10 people, and we were each assigned a job. Well, in our particular team, we were the administrative team and responsible for patient registration and getting that information from one area to another as quickly as possible. Well, some people in our team were having a little bit of hang-ups of where their paperwork should go and the route to get it. So I decided with the team leaders that maybe we could have another cuddle and talk again about who had what job and what position we would put each member of the team. So we then reallocated the jobs and our team was able to get our information to where it needed to be in a timely manner.
Oh, that's great. Tell me about a time when you had too many things to do and had to prioritize your tasks.
Every day in the bed management world. So bed management is the patient placement system at the hospital. The hospital has about 1,100 beds with an average of 200 admissions a day and maybe 150 discharges. So there's always, some pieces of the puzzle that don't always fit. And we have to kind of work together with the clinical side, with the nursing supervisors and the units and the capacity areas of the hospital to see who might need to flow first to make everything streamlined.
Great. Tell me about a time when you had to go above and beyond the call of duty. How did you handle that situation?
Well, my first day in my new job was Marathon Monday. And that particular day, we had a tragedy here in Boston. And I didn't feel comfortable leaving until everything was kind of settled, which, it can't really be settled, but I just kind of jumped in wherever I needed to be. I answered phones, I just gave support, sometimes just hugs, but we did what we needed to do to make sure everyone made it through that day.
Wonderful. Tell me about a time when you worked effectively under pressure, although this last example did sound rather pressured.
Well, that was a pressuring role. That whole job was pressure. But the CDC in Boston came up with some new capacity rules for inpatient facilities in the state. And when we were our first obstacle was we couldn't turn anyone away, and the hospital was at complete capacity, and there was a snowstorm, and people couldn't leave. So we didn't know what to do with the patients who were being discharged versus the patients who needed to come in. Well, one of the chief nurses at the hospital came down and basically said, "What are we going to do?" And I, at that point, was not sure, but she did say we had some sleep study room available at the Holiday Inn. So I suggested to patients that could not get home, maybe we could board the patients there to get the new patients admitted to the space that they were in.
Wonderful. That's great. Let's see. Is there anything else that you would like us to know about you?
I'm hardworking. I learn quick. I work well with a team. I don't mind working alone. don't think you'll be disappointed if you give me a chance to prove it to you.
Well, that's great. It's really been such a pleasure meeting you, Melinda, and you'll definitely be hearing from us within the next couple of days.
The pleasure was all mine, Grace. Thank you very much.
Thank you.